Earlier this morning, we announced several actions to combat COVID-19 in the Commonwealth. The Massachusetts National Guard will once again answer the call to assist residents. Hospitals across Massachusetts are experiencing an unprecedented demand, and there remains a critical staffing shortage in many jobs and many roles to meet the needs of our patients. We're committed to ensuring our healthcare system meets the acute care needs of our residents. To support hospitals that are experiencing staffing shortages, the Governor is activating up to 500 members of the Massachusetts National Guard to ensure sufficient non-medical personnel are available to deliver support to patients. This will allow hospitals to free up clinical staff to provide higher levels of care to those who need it. Beginning with training this week, 300 of these Guard members will support 55 acute care hospitals as well as 12 ambulance service providers to address the non-medical support needs of our hospitals and transport systems. They will be on site Monday. These non-medical Guard personnel will serve in roles such as non-emergency transport between facilities, like transporting a patient from a hospital to a nursing home, assistance transferring patients between, bringing the patient being discharged from a hospital to a nursing home, patient observers, providing continuous or frequent observation of a patient who is at risk to harm or themselves, security support to help maintain a safe workplace, in-hospital transport, bringing a patient via wheelchair or, if needed, a stretcher from their patient room to tests such as x-rays or a CT scan, or from the emergency department to their inpatient floor, and food service, delivering patient meals. Additionally, to further address the critical staffing shortages in our hospitals, the Department of Public Health has released updated guidance to hospitals regarding non-essential elective invasive procedures. Effective 12:01 a.m. on December 27th, all hospitals are directed to postpone or cancel all non-essential elective procedures likely to result in an inpatient admission in order to maintain and increase inpatient capacity. I want to be clear, our hospitals remain ready to care for the urgent needs of the residents of the Commonwealth. In response to the rise in cases and hospitalizations we are seeing in the Commonwealth, and as we learn more about the emerging Omicron variant, the Department of Public Health advises that all residents, regardless of vaccination status, wear a mask or face covering when indoors and not in their own home. We particularly urge this recommendation if you have a weakened immune system or if you are at increased risk for severe disease because of your age or an underlying medical condition, or if someone in your household has a weakened immune system, is at increased risk for severe disease, or unvaccinated. I know we are all feeling the pangs of pandemic fatigue, but as we all prepare to gather with our loved ones, a tradition long overdue and has been interrupted by the COVID-19 pandemic, it's important for all of us to remember that the vaccine and boosters are highly effective at protecting against serious illness, hospitalization, and death. The best possible gift you can give to your loved ones this season is protection from COVID. Get vaccinated, get boosted, and have a safe holiday.